Welcome to the Title X Program Requirements Training. This training will provide a concise review of the Title X program and an overview of the requirements applicable to all family planning staff. What is Title X? Title X of the Public Health Service Act was signed into law in 1970, recognizing family planning as basic health care. It remains the only federal program dedicated solely to providing individuals with comprehensive family planning and related preventive health services. Since its establishment, Title X has played a vital role in expanding access to care for low-income and uninsured individuals. Offering services such as contraception, breast and cervical cancer screenings, basic infertility counseling, and sexually transmitted infection testing and treatment. Title X-funded clinics have become a trusted source of care for millions, especially in rural and underserved communities. Today, Title X continues to be a cornerstone of preventive health care, serving as an entry point into the health system for many who might otherwise go without care. Its legacy reflects more than 50 years of advancing reproductive health access across the United States. Why is Title X important in Tennessee? Title X was created in response to the recognition that access to family planning is essential for improving public health, reducing unintended pregnancies, and supporting the economic stability of families. Family planning was identified as basic health care, and Congress affirmed that no woman should be denied access because of her income. Here in Tennessee, Title X services are offered through health departments in all 95 counties. The program provides individuals, both women and men, with affordable, effective, and voluntary family planning services. In short, it helps people decide the number and spacing of their children, supporting their reproductive life goals and helping them be at their healthiest before becoming pregnant. These services directly align with the priorities outlined in Tennessee's maternal and infant health strategic plans, shown here, making Title X a critical piece of our state's public health efforts. To explore these strategic plans further, please scan the QR codes below each image to access the full documents. In 2014, the CDC published practice guidance for the provision of quality family planning services, known as the QFP. This document, shown on the left, established a framework for quality pre-pregnancy sexual and reproductive health care within the healthcare system. The QFP was updated in 2024, shown here on the right. While maintaining the definition of quality, the 2024 revision places a stronger emphasis on patient-centeredness and individualized sexual and reproductive health care. It also expands upon the scope of services, incorporating new technical guidance and addressing a broader range of sexual and reproductive health needs. Notably, it shifts the conversation from assessing a reproductive life plan to exploring reproductive desires, underscoring the importance of tailoring care to the individual. Direct family planning services continue to remain central to the Title X program, including contraceptive care, pregnancy testing and counseling, assistance in achieving pregnancy, basic infertility services, and STD and HIV care. In contrast to the pregnancy-centered approach of the 2014 QFP recommendations, the 2024 update broadens recommendations for primary care screening and services to all individuals accessing sexual and reproductive health care, ultimately advancing the health of both individuals and communities. Who is eligible for family planning services? Family planning services in Tennessee are available to legally eligible men and women who are of reproductive ability or capacity, and desire family planning services, regardless of income or insurance status. The program is designed to reduce barriers and ensure that everyone can access essential reproductive health services. While services are open to all, priority is given to low-income individuals and those who are uninsured. Clinics use a sliding fee scale based on the federal poverty level, and many family planning patients receive services at low or no cost. Importantly, no one is denied care because of an inability to pay. Furthermore, access to family planning services must never depend on a referral from a physician or another healthcare provider. To ensure access to family planning, the Title X program has several service requirements. The first service requirement is that all family planning services must be provided on a voluntary basis. This means that 1. Family planning services must not be a prerequisite to eligibility for other services, assistance from, or participation in any other program offered. In other words, a person may not be required to use family planning services to receive, say for example, WIC or SNAP. Second, family planning patients should not be coerced to accept services or coerced to use or not use a particular method of family planning. Finally, any personnel working with Title X funded projects may not coerce or try to coerce any person to undergo an abortion or sterilization. Doing so may subject said personnel to prosecution, a $1,000 fine, 1 year imprisonment or both. For best practice, all family planning clients should read, or have read to them, the consent form stating their understanding that receipt of services is voluntary before signing. Confidentiality. Please follow institutional policies regarding HIPAA. Be mindful of potential breaches of confidentiality, like through insurance EOBs, lab reports, and pharmacy notifications. Title X also requires that services be provided in accordance with nationally recognized guidelines and standards of care, are client-centered, non-discriminatory, and trauma-informed. The QFP, mentioned earlier in the presentation, is considered the standard of care for family planning. In addition to service requirements, Title X also has training requirements. The first training requirement is an overview of Title X and the service requirements, which were just covered. Additionally, trauma-informed care and patient-centered skills development training are required. These are required for all new employees working with the family planning program, and once per grant cycle. Annual training requirements include mandatory reporting, human trafficking, and domestic and interpersonal violence. 2 trainings specific to adolescent patients seeking family planning services are also required. This concludes the Title X requirements training. Thank you for your attention. For questions, please reach out to the family planning team at familyplanning.health@tn.gov.